But it was that moment with the soft tissue technique. It was a technical way of addressing my imbalances and sort of turned the corner for me. How I see soft tissue therapy is like a systematic manipulation of the soft tissues for a specific purpose of enhancing the physical condition. Really. As you get older, you have to put more into body maintenance. But if you get the right type of soft tissue therapy, that has a more lasting effect. So you haven't got to invest so many hours in body maintenance a week if you're having skilled soft tissue therapy. Sort of biopsychosocial model of how different people are, just the bodies and the injuries, and one person's injury even within the same sport and age group could be very different, because people do say really positive things about feeling empowered. I treat people in their 80s and late 80s that, I didn't know I could get better from that. I thought that was it. What should I expect from my body? I'm in my 80s. You have an injury, you have soft tissue therapy, and you move on.
My guest today brings over 3 decades of experience in the field of soft tissue therapy. She's played a pivotal role in educating therapists across the UK and beyond through her work as a senior tutor at the renowned London School of Sports Massage. She's the founder and director of a thriving private practice in East Sussex, and for over 25 years she's worked with elite athletes, top performers and executives, specialising in injury prevention, rehabilitation and performance enhancement. She is a respected educator, regularly delivering seminars for therapists, trainers and coaches nationwide, and has lectured at leading institutions including the Northern Institute of Massage and McTimoney College of Chiropractic. She's also been part of the Wimbledon medical team for over 15 years and, importantly, she's the author of Soft Tissue Release and co-author of the Soft Tissue Release Handbook, Reducing Pain and Improving Performance. I'm honoured to welcome Mary Sanderson. Hello and welcome back to this exciting episode of Unleash Your Inner Athlete. And as you know, I'm joined by the amazing Mary Sanderson, sports soft tissue therapist extraordinaire, aren't you, Mary? Welcome to the show.
Nice time.
It's good to have you here. We've got a lot to unpack today because you've been doing this for a long time and you've worked with, as we've said before, a lot of different athletes. Yourself, you're a bit of an athlete yourself as well. Entertainers, business people, so across the board. So you're really well versed in the different types of bodies and what's required of them. But also what we want to get into today is a bit what's happening to soft tissues as we get older, the importance of maintaining their quality and keeping them in good condition, particularly if you want to be active and when you maintain being competitive in sport, but even just for general quality of health, because we know that as we get older, we get more tension in the muscles and the tendons and the ligaments. They lose their elasticity, which can be a problem, particularly when it comes to movement. And the stats are showing that, by 2050, the 2 billion people will be 65 or over, and mobility will be a precursor to their decline. So this is really important in terms of reducing that decline, maintaining your health and wellness, but also really important as well in terms of, your energy, because good muscle quality is really important for oxygen, which is going to give you energy, but also things like, as we get older, you become a bit more susceptible to things like insulin resistance. And good quality muscle is really good for preventing that, so reducing that risk of insulin resistance because of the way the glucose uptake with good muscle quality. So you want to get into a bit of that. We want to look at, different types of therapies, soft tissue therapies you can use, the difference between sports therapy, soft tissue therapy, or sports massage therapy, and maybe different types of massage that are out there, and why particularly sports therapy is really perhaps the way you want to go when it comes to this sort of thing, the different techniques that are used, and kind of how you find that really great therapist who's going to know their stuff and really help you with whatever it is you want for your health and fitness. So Mary, there's quite a lot. Because you're an educator as well, aren't you? So you teach a lot of people. It's not just that you're a top flight therapist. You've worked at Wimbledon and with many different elite sporting events, but you're also an educator, so you're well versed in everything soft tissue. But first of all, so people can understand who you are a little bit more and get to know you a little bit, how did you get into this side of things? What excited you about the sports soft tissue therapy?
Yeah, with soft tissue therapy, I had my own journey through injury, like a lot of us therapists do have. I was always interested in sports and enjoyed sports as a schoolgirl, and then got heavily into athletics and was enjoying competing. And then I did do a massage course. I did a sports degree, then I did a massage course, which was advertised in Athletics Weekly. and just a year part-time course. But it's just really inspiring. It was very educational for me of working through the tissues. I hadn't really had massage. I don't think people had massage back in the 80s so much.
No.
Certainly necessarily from qualified massage practitioners or therapists, which we sort of do more therapy now than just massage. So then during my course, I ended up, because I was working in the health and fitness industry then, like personal training and exercise prescription, and I ended up with my own journey with a chronic injury pain. And so I went through lots of different therapists. It was physiotherapy, osteopathy, chiropractic and podiatry and acupuncture, and it was a different world definitely back then in the 1980s. But it was a soft tissue technique, a massage technique that helped me break the cycle. So that really inspired me to head down this journey. And so my first massage course was in 1991 with the London School of Sports Massage. And then, so it's obviously continued courses and learning and integrating treatments with other practitioners from different, from chartered physiotherapists to chiropractors, and as you do the same, multidisciplinary approach to managing pain and injury. But it was that moment with the soft tissue technique. It was a technical way of addressing my imbalances and sort of turned the corner for me. So,
and what was kind of the transformation for you from doing that? What was it about the soft tissue that made the big difference in your experience?
It was actually touch, because I think then you'd have had massage, where you have a general massage. You go and have it through a run, you might have a leg massage or back or full body massage or whatever. And then you have all the technical, going to a physio, having an assessment. So I had been to a physiotherapist and had an assessment, an NHS physio, and it was an tight IT band. And I'd just given some exercises. And I'd been to jointy people, chiropractors, osteopaths that had done work on my sacroiliacs and facet joints in the lower back. And then I'd had podiatrists. I think I'd been given some inserts, some something for my feet. So I don't wear them now, so I don't think there's anything too wrong with the feet situation. And then I had different things, and I wasn't really being manhandled. So I hadn't been manhandled in a technical way, really. So very valuable diagnosing, and they're all obviously very important, necessary parts of, resolving a chronic injury situation. But for me, there was a missing link with something precise, a technical way of addressing my soft tissue pattern that had become chronic. So it's settled in, and the exercises alone weren't enough to break the cycle. So I needed something there to release a stubborn spot and set me off, so all those other things could work better.
Yeah, because I guess you can have these things for such a long time, can't you, and not realize it. And I think this is a problem a lot of people find. I had back problem for years and years and years, and it's finding those solutions. People don't often think that something like soft tissue or any sort of massage is actually they don't consider that as part and parcel of getting yourself back fit. It's kind of like a nice little luxury. But why do you feel that it's, we've both been in the industry a long time, and we both know the benefits of it. But why is this now? Because recovery is becoming a really important part, and massage is part of that recovery, whether it's recovering from a day at work, recovering from the gym, recovering from a sports performance, whatever it may be for you. But why is this so important? Why do you feel now?
Yeah, because I see that
bringing this tool is going to be a really key, important part of your health and fitness.
I think soft tissue therapy is quite established from where I sort of am in Hastings and some of the places we work, like at the tennis and things. I think it is really established and well respected. I think the hardest thing is for some of our colleagues thinking we all work quite different with the soft tissues, don't we? And there's so many different ways of addressing the soft tissues. There's massage, there's sports massage, there's Swedish massage, there's soft tissue therapy, there's sports therapy. There's so many different terms that are being used, and I think clients sometimes don't differentiate. Like, people don't know. I remember being asked various times, "What are you?" And I say, "What is a soft tissue therapist? What is that?" And I think we've trained in very different places, haven't we? And so I think that's hard to sort of grasp initially. But how I see soft tissue therapy is like a systematic manipulation of the soft tissues for a specific purpose of enhancing the physical condition. So preventative, so easing out tensions and sort of knots, adhesions, restrictions, granular tissue before they become an issue, but also with the management of injuries, specific injuries, the soft tissue component of those injuries in chronic conditions, really. And also has a role with event preparation, definitely obviously recovery with flushing and more traditional massage strokes, effleurage and kneading with recovery, but also in sort of prep, sporting event prep, preparing for an event or competition, enhancing how somebody feels, or integrating as part of a warm-up, and maybe managing certain things that are going on sometimes when people are trying to compete with pain or chronic pains, or sort of things that are being managed for them to allow them to compete. So I think that's the thing, that's therapy. There's a soft tissue therapy where you're working with soft tissue techniques, but isn't just effleurage and kneading, but other soft tissue techniques to work the soft tissues to enhance the physical health.
Because as I said earlier, it's all about, as we're getting older, is keeping that range of motion. Because if you have that range of motion and you reduce that stiffness, that tension, it not only means you're going to be able to exercise better, so you're going to get better effects from the exercise you're putting in, the conditioning work, particularly if you want to play sport as an older athlete, being able to maintain that, because that's reducing the inflammation and the wear and tear and dysfunction that can cause problems and increase the risk of degeneration and all that as well. Plus as well, obviously, the way it affects muscle quality, muscle mass and muscle density, muscle bone density and quality are all interlinked. So that enhances that. So it's for me, it's a kind of a cumulative effect by having that, using that soft tissue as part and parcel of whatever else you're doing in terms of your health and wellness.
Yes, it's important to keep moving, isn't it? As you get older, most of the evidence, what I've read is as you get older, you need to keep moving, and you need to respect recovery. You should still work out, exercise intensely, but you have to respect recovery more. The connective tissues become more rigid, and also you've had life. You've had the knocks and that of life, haven't you? You've had sort of injuries in your body, in events. You've had all your lifestyle stuff, and I think that is where soft tissue therapy really comes into its own with its lifestyle stuff. Whatever you're doing with your sports and your activities, you've been commuting, or you've been sitting behind a desk, or you've been labouring, or whatever. You've got those knocks in your body, haven't you, that accumulate over many years, and so you have to respect that, what your body's been through as you're aging, and get sort of very precise into some areas. And really it's quite surprising. I've got lots of anecdotal evidence of people treating. Obviously, people that come to us are often, they're convinced of the benefits of soft tissue therapy already, aren't they? And they're seeing the benefits as they work. So we're sort of preaching to the converted. But it's like you see people improving their running times as they're getting older, for example, or feeling stronger or getting more movement. And you think, oh, I'm old now. That's what I expect. I can't turn my head. I've got wear in my head. But actually, there's so much you can do to return that movement, and it's not over. You do your mobility exercise you get from your physiotherapist and your Pilates instructors, and then you can add in your soft tissue techniques to enhance tissue health, so then you're better able to do those exercises. And I think it's those things that just transform people. Something as simple as, like, you're getting older, you're driving a car, your head's full, you're noticing that you're having to turn your whole body to look behind you. And then you get some advice, sort of the head retraction exercise, the thoracic mobility, and then the soft tissue therapy. You're working within those movements to release those tissues where the restrictions are, so someone is better able then to perform those exercises. And I think that's a big thing with the aging population.
I think it's kind of that thing, isn't it? The older you get, the more you've got to do.
Yeah.
You don't get to just sit back and enjoy. Well, you can sit back and just do nothing. It's up to you. But if you're really serious about increasing your quality of life and your activity and being as youthful and as energetic as possible, then this is all part and parcel of it. And there's a reason that, athletes, it's part and parcel of the medical team to keep athletes going. And I guess you might say, well, I'm not a professional athlete, but
Yeah,
Doesn't
but it's
matter
probably
because
when you get older, you have to put more into body maintenance. But if you get
yeah,
the right type of soft tissue therapy, that has a more lasting effect. So just sort of stretching, because you're getting very precise within the connective tissues that draw the muscles to the joint. So if you've got a stiff joint, it isn't just about stretching the muscles and alleviating muscle tension. It's about actually working the tendons as they merge into the bones, and you're actually helping sort of really lubricate those joints. So a soft tissue therapy can actually make that, like, you haven't got to invest so many hours in body maintenance a week if you're having
yeah,
skilled soft
yeah.
tissue therapy.
I think that's the great thing about the therapy side of soft tissue rather than just a general massage, because it is so specific. And you don't do necessarily the full thing. You focus in. I mean, you kind of got to look at the body globally anyway. We know that. But when it comes to a specific, say, a shoulder restriction or a lower back or something like that, you can actually focus in, and then you can look at the whole global and zone in on the specific links, if you like, below, upper and lower body, below and above and below the problem
Yes.
area, and then just really focusing on increasing that range of motion, working a little bit deeper, but also, like you say, being able to get that range of motion and release all the tendons and ligaments, because tendons and ligaments, as we know, unlike muscle, do not have the blood supply. So they take a lot longer to repair and recover and gain that movement, if you like. And if you've got tension,
the most of that is that the tendons, you want to release some restrictions, but actually then prepare them ready for loading and strengthening, isn't it? So I think there's so many techniques and different ways of working, and I think we've learned we've done our training, education and our courses, and then it's like each person is so different, and it's not just their age, even within the same age, or even if they're doing the same sport or the same occupation, people present very differently, don't they? So it's like, and people will respond emotionally to different techniques. Some people, definitely want heavier treatments, don't they? And some people don't. There's that whole subjective element of how deep to go, and then you're sort of getting the feedback from someone how their tissues are responding. But also, they're different conditions, different techniques work for, obviously. And so that's about, assessing someone's, specific needs and sort of what they're doing, but actually getting the feedback from what they're responding, how they're responding. And some of these soft tissue techniques, dynamic, you're actually unraveling things, seeing things they're very functional, so you're seeing things unravel while you're working. Some of the more dynamic techniques.
So I mean, that's the thing. I think that people, when it comes to sort of the different sort of types of massage you can get, and the difference with soft tissue therapy is the amount of techniques that are used within that. Because I think people need to understand a little bit about what techniques are used and what they're used for, in that sense. Because, like we say, soft tissue therapy is quite specific. You're not dealing with just the superficial muscles, and you're going to go in deeper, because it is a very specific and tailored treatment in that sense. And you've done your assessment of the person, what their medical history is like, what their their health and fitness routine is, and any health or medical issues that could be cropping up, and then working within that. So yeah, I mean, what kind of things would people expect to get when they're having a soft tissue? What sort of are the different sort of techniques that can be used, and what they're used for?
Yeah, because I even think it used to be like massage, Swedish massage, then sports massage. I don't know when that became a thing in the late 80s. It became a thing, and it's like, is it massage but just with elbows, just heavy massage, or sports people want a heavier, more robust massage, and it's much more complex than that, because just because you're going deeper doesn't mean you're more technical. You're being more specific. So you can have a very technical, specific treatment that's more superficial, like layers. Tensions can be more in the superficial fascia, or layers, or around sort of the bone attachments or whatever. So it's not necessarily a depth thing or a vigorous thing, and a lot of very skilled releases can happen very superficially level without being painful, and it's not about being deep and painful. So I think with the techniques, if you're doing a soft tissue
soft tissue therapy.
There's sports massage courses. There's sort of different levels. Like, we haven't really talked about qualification and accreditation. So I think if you're actually looking for a therapist, really, if you're looking for therapy, soft tissue therapy, then you need to look for like a level 5 qualified person, because if you've gone to a course that's offering level 5 and it's appropriately accredited, then you're looking for someone that's done a training where they've been externally assessed, they've gone through certain amount of case studies, they've learnt various techniques. They've learnt Swedish massage, effleurage and kneading, petrissage, but they've also learnt techniques, soft tissue release, some myofascial techniques, some strain counter strains, trigger points. So there's some more technique work, as well as understanding some more sort of assessment techniques and to integrate treatment within how soft tissue therapy is integrated within other physical therapists. So that's what you're looking at. Then a lot of courses are more massage, level 3s, level 1s to 3, and because there's a lot of courses now where they're online. You're learning and getting a massage qualification without actually even.
Which seems ludicrous to me, because you have to have that hands-on treatment. You have to feel. You have to.
Yes, because that's the biggest assessment for a soft tissue practitioner, is to actually obviously feel the tissues and get the feedback from the tissues. So you watch a video or learn to do some basic massage techniques, but what are you learning from a therapy point of view? Or so you have to really, I think, when you're looking for somebody, look at where they've trained and what level they're at.
Yeah. And so, and sort of something, because you work at the London School of Sports Massage, haven't you? You've done a lot of work with them, so they're usually
trained initially, finished in '91. I've done teaching with them ever since, pretty much. So they're level 5 BTEC accredited qualification. But there's so just check. There's other schools as well.
Yeah, because I guess for some people, maybe there's always one is they obviously fear depth. They fear, it's going to be deep, it's going to be painful.
Yeah.
But as we've stated, it doesn't have to be deep to be effective. It really depends on what the problem is that you're struggling with. So always trust, if you trust that you've got the right therapist. Yes. Trust them to use the right technique. And if it's not particularly deep, maybe you don't need that sort of deep sort of elbow.
Yeah. You know what it's like. You have a relationship with someone, they come for treatment, you want to get the right fit, and you just see someone the first time, they've generally been recommended by somebody else, but that first time to get, you're getting to know them, how they're going to respond. And then generally, if I feel I've not helped somebody or made a difference within 3 treatments, I would sort of refer on or integrate with somebody else. Or you get the feedback, and you shouldn't make somebody feel sore from treatment. If you go to and someone feels sore, bruising, that is actually tissue trauma. So you've actually damaged them, haven't you? Sometimes if something's particularly congested or granular, then you can feel a bit tender for maybe up to 48 hours. So I'll sometimes warn someone if they're used to therapy or some deeper pressures that they can feel sore. But if they're sore for longer, I'd say I've been a bit heavy, so let me know. So it's empowering someone to give the right feedback so you can get the right fit for somebody. But I think some of this technique work, particularly with like STR, for example, it's very interactive technique. So people are sort of feeling how their body's responding as you're working on them.
That's what I think is good about soft tissue release, is because you have to include your patient in the treatment, because you need their participation in that treatment. So it's not necessarily always a passive thing. You actually have, the patient has some control to some extent, which must be comforting, surely.
I think so, and particularly for people that have been in chronic pain and uncomfortable, to empower them to be in control. They can stop the movement. So if you're freeing something, if you're working on a shoulder impingement and someone's lost some movement, and then they get to a point where it pinches and it's sore, you can actually sort of press somewhere and they're just moving within sort of a comfortable range. And often that's a good example of where I do quite like an integrative approach, like say a shoulder impingement, a very common shoulder condition people get, where they're losing a range of movement in their shoulder because they've got impingement of a tendon, say in the acromial arch. And they might be given some lovely physio exercises to help with the scapular movement and to strengthen posterior cuff or whatever. And then the soft tissue therapy comes in so beautifully with sort of that routine to free up the muscles that are tight. So commonly the balances between the usual muscles that we sort of work on, pec minor classically, you can sort of work in there to sort of free up, to facilitate the sort of strengthening regime is very good. But someone is then empowered to work within that and feel movement changes while you're actually working on them, while you're treating them, which is very good. And then they could almost be doing their band work while you're engaging the tight pec minor, for example. So yes, I think the interactive angle of the sports therapy, soft tissue therapy.
Which brings us leads nicely into postural and the muscular re-education and sort of the corrective aspects of doing soft tissue. Because I've done a lot of corrective exercise. I'm a corrective exercise specialist, and the importance of you get the muscles, the imbalances with muscles, which then can cause your dysfunction around the joints. So being able to, as you said, sort of bring in that soft tissue and flexibility work, but also team it well with the conditioning and the strengthening of a particular weak area that you need your focus on.
Yes. Yeah, I mean, that's perfect. I love working with you like that. Okay. It's
You're a great team.
Yeah, so I think that's interesting sometimes with the coaches, isn't it? And what people are seeing with the movement. And I think, and that's where, so I really love working with the soft tissue release, and that's my sort of favorite technique. And I think I have, like someone like you, like a coach, conditioning coach, but the physiotherapists and chiropractic friends I have particularly love that, because they've got their other stuff to do, their assessments, their joint moves and their strengthenings and nerve stuff, assessments, and then they can, if they want to dip into a bit of soft tissue release, it's very functional, so they can dip in with a little bit of soft tissue release to release something and help with the re-educational process. All the sort of knee tracking stuff, the movements, when you're watching something in a functional situation, because it's functional, you can get someone doing a one-legged squat, like your lovely arabesques and one-legged thing as you do with me, which you're not happy with my technique still.
Still after all these years. But you only do them once a year.
So it could work. Sort of why is one leg, that's a classic, isn't it, where people are less balanced on one leg, or their knees dropping in on a sort of half squat more than the other. So you're looking at sort of some of the glute imbalances and glute adductors and some of those, and you can sort of work those and then sort of reassess the arabesque technique, for example.
Yeah. And I think when you have a very experienced soft tissue therapist, they can kind of bring in that sort of movement assessment, and particularly if it's, say, you want to be a better tennis player or a better runner or a better golfer, they can also assess that and see where your function is, and then address how your muscles need to move and what they need to be doing from a soft tissue point of view to be better, create the range of motion, whether it's to, rotation through the shoulder or, rotation through the hips or waist or whatever.
Yes. Yeah, no, it's perfect. I think the strength is so good. People are sort of getting to strength, really think about strength now, everyday life, isn't it? But I think you can get strong and you can get stiff. But if you can get strong and then have the therapy alongside the stretching, it's the perfect combination, isn't it? So,
I think those two things go very well, particularly as we're getting older, because we know that really important now for an aging person, particularly an aging athlete or anyone, is strength training is now being shown that you have to do more strength training than in fact you need to do sort of cardiovascular, but you also need to keep the quality of the muscle there from a soft tissue, range of motion, flexibility, elastic kind of perspective as well. Yeah.
It's just some of those things that happen with aging. It's like some of the things that become mainstream, isn't it? The standing on one leg, or sort of, the balance things, and, lifting your feet properly. That actually, if you can sort of release some of the tightness, some people lose their confidence, don't they? You get older and you see old people not lifting their feet properly. You actually say you work the ankles, you make sure you've got their dorsiflexion, their foot muscles are loose, or the plantar fascia, the intrinsic foot muscles and ankle muscles are good, and then they've sort of able then to maybe learn their first stages of balancing and progressing through that. So,
especially if they're overcoming like an injury, because as you're older, it takes you a little bit longer to recover. So what this also helps with is speed up that recovery process, because you're helping to get, the nutrients and the oxygen getting to that particular area, clearing out the inflammation and getting the scar tissue down and creating that range of movement. So you actually perform if you're coming back from injury, you'll rehab more effectively, and you're able to progress on to the corrective, and then there's the conditioning, the strength training to get you back to where you want to be in a much quicker than otherwise you would have done.
Because a big thing is you lose touch with your body when it's been stiff for a while. And some of these chronic things that we address, it's like people, they've been coming on for a long time. If they're not, someone's not, if an older person hasn't been exercising for a while, or is just retired, or stiff mid back, they don't really realise they've got stiff because it's happened slowly over a long period of time. So it's actually reacquainting someone with their body, isn't it? And so if you suddenly do loads of things, they're going to sort of feel stiff or hurt. So you gradually introduce sort of the mobility and the strengthening, and then the soft tissue work. Then that's
the thing is if you're strengthening, but you don't have that range, you don't have that nice suppleness to your muscle, you're just going to exacerbate something, or further down the line, you're going to create something.
Yes. You don't want to strengthen in the wrong position, do you?
No.
So,
and it's getting the right strengthening as well. Yes, we can all want to go down and decide, right, I'm going to go down the gym, I'm going to get fit, I'm going to do my squats, I'm going to do my bench pressing, all this kind of stuff. But if you've got dysfunction there, if the muscles aren't capable of coping, and you're not progressing in the right way, a systematic way with all these things, you're actually going to end up causing more problems, or put yourself in a chronic pain situation. But actually all you need to do is just address the soft tissues and get the movement, and then the rest becomes easier.
It's that mobility, that strength, that flexibility, those sort of three things, isn't it? And then that whole texture of the muscles. What do the tissues, the soft tissues, so the muscles, tendons, ligaments, what do they feel like when they're in good health? They're sort of pliant and strong. You have big, bulky, strong mesomorphic muscles. We can have slender distance running muscles, can't you? But you want them to be strong, sort of in balance, sort of flexible enough for the action they're going to be doing, and sort of the joints be moving as well as they can.
But I mean, the different body types, that's the difference, because what you can actually take and cope with. And again, even with the soft tissue, it's kind of got to be a progressive thing. You don't want to go in deep straight away if someone's got a problem, because you're going to make the thing worse and cause them more pain. And if someone has that fear of, I don't want any more pain, and some resistance to that, and then see the psychological thing going on as well, that can affect the muscles in terms of stress and inflammation and tension within the muscles.
But that's so that people respond, that whole model, that sort of biopsychosocial model of how different people are, just the bodies and the injuries, and one person's injury, even within the same sport and age group, could be very different because of all that other stuff that's going on, sort of tension and lifestyle and what's happening at home.
The body's interlinked. This is what I'm big on, the body-mind connection and how interlinked everything is. And you've always said you've got to look a bit more globally at the body, and you got to, it's okay, you may not have the benefit of a sports team and a whole team of people working with you, but you can find those little things that you can add in, and use them to much greater effect. Don't use it as a nice to have, or just a flippant thing, but actually seriously look about what you need to do with your body, what you want to do, how you want to feel, and then pick those techniques that you can integrate quite easily, because it doesn't have to be a difficult thing, really.
No. And I think that's something probably the massage or our soft tissue therapy offers. Is it like quite a long treatment with somebody, isn't it, to unravel that more holistic side? So you're looking at the whole body, but also sort of a little bit of background, where they've come from, and especially after the follow-up treatments, and thinking, it felt like it came from playing badminton, but did it really? Is it the badminton, or is it you sat down all day working?
Well, sometimes people don't.
You've done a warm up, and then you're expecting to leap around, and
because sometimes you talk to people say, I don't remember, I don't know where it happened. So you got to unpick that a little bit, because it's quite helpful to know if you can. But it also comes back to something you said earlier as well, about knowing your body and getting in touch with your body, because once you can do that as well, you can connect your mind with how your body's feeling, what feels normal to you, what feels like something's not quite right.
Very lovely about our techniques, isn't it, that people do say really positive things about feeling empowered and actually saying, I didn't know that. You treat an older person, you think, oh, I'm past having to get better. I mean, I treat people in their 80s and late 80s and think, oh, I didn't know I could get better from that. I thought that was it. What should I expect from my body? I'm in my 80s. But actually, I feel empowered, I feel in touch. That is a bit granular, but that can change. I can change that. I can do that. And it's finding a time to do a few little exercises in between treatments. You don't have to say, if you're doing technique work, you don't necessarily need loads of treatments either. If you're doing good treatments, you don't need loads, but you obviously, you've got your self treatments, haven't you? Self massage things and little and often sort of stretches and some of those seated yoga and things for older people that don't want to be so dynamic, but you can do to keep your mobility and to maintain the changes you've done within a sort of massage session or soft tissue session.
Yeah, because I think that can obviously concern some people, particularly if they're not really big into gyms and stuff. It doesn't have to be lots of heavy weights. You can use your own body weight. It can be actually mobility as you're getting older is really, really important, probably more so. Doing more mobility work and more, body weight stuff that feels natural and good. And it's just finding that one that's right for you and then incorporating it with the soft tissue work.
Yeah. Yes.
And a good therapist is going to be able to communicate with your trainer, your physio, your doctor, or whoever you work with.
And the client should never feel bad about sort of asking or saying things are too heavy or they didn't like that technique. Should always be open in communication, because it's always about getting the right fit for them. And you can say, it's a bit sore, but that's the reason why, or maybe this technique isn't for you, we'll try this. But sort of being honest is very good. And also, I don't like to think of people being frightened of the pain, because some people, and obviously we've both treat a lot of sports people, and elite sports people famously wanting no pain, no gain, and sort of you're wanting deeper, and you think, gosh, we
need the treatment after that.
Sometimes less is more, isn't it? And it's you can, and some people don't want the heavy treatment anyway, and you don't want to frighten people like that away. And equally, some people that really wanting heavy work, you say actually it's not always about heavy work, it's about being precise and where you're treating, looking at the attachments, particularly.
Difference between what they need and what they want.
Because a lot of the self massage stuff with all the tools and the tennis balls and foam rollers and things, that you're actually treating the bellies of the muscle or the massage guns and that, but actually the therapy and that comes in to its own, doesn't it, with actually looking at sort of the attachments, and apart from just addressing the faulty movement patterns, it's actually looking at the sort of attachment. Some of those things can't do. So,
well, that's the thing is with these little machines, that they're great in some instances if you're feeling a bit tight, and they can help give you a little bit of release, but that's not necessarily where the problem is. So it's don't be too fixated on something because it's trendy to have, like the Theraguns and all that. They're a useful tool for certain things. But if you're having, say, a chronic problem or something that's just not relieving, then you have to look beyond that. You have to look beyond the superficial.
Yeah, because we do it, don't we? If I have a pain, I still rub where the pain is. It's not like looking, where's it come from?
Well, it's kind of, it's that kind of comes back to that, having that control. And you think it just makes you feel a little bit better. And if it makes you feel a little bit better in the moment until you can go and get some treatment, then do it.
Oh, no, I think they're definitely useful. People use them, don't they? But it's just saying they're sort of more temporary to release more muscles, aren't they, rather than sort of the changing and moving on, changing the fashion.
And sometimes just that psychological thing that it's doing something. It's you're in control and you feel like you're doing something to help yourself. It's just help you psychologically. But sometimes you just need, in some instances, you need to have this more specific treatment to have a long-term benefit from it.
Because some of those techniques are very powerful and they make a big difference. And you don't need to necessarily, you can use it as a sort of a treatment, as in not less, because obviously massage is used so much in sort of maintenance and managing sort of lifestyle things, tight upper traps from work, have them released. Fine, but there's some things, you have an injury, you have soft tissue therapy, and you move on, and then you don't necessarily need any more than a few treatments to move on until next time. Well, hopefully not next time.
People's heads are going to be thinking, oh my god, I've got to pay for something else now every month for the rest of my life. No, you don't have to do that. Not if you have a good therapist.
No,
you don't have
to. It's a dependent. You don't want to be dependent on things, do you? That's the thing about that empowerment. stuff, isn't it? Sort of good therapy. So this is good, and you've got this, and you haven't got time to do that. You're not doing as much stretching as you should, or you're training particularly hard at the moment, or obviously you're or the elite sports people and that have lots of sort of therapy all the time. But there's a time, and if you don't have somebody, you don't necessarily need it. It's a sort of luxury, because people should be sort of being guided to be sort of independent as well of what they can do.
And it comes back to, I guess, as well, to that we touched on the neural re-education, because what you are doing is re-educating the muscle. So in the process of doing the soft tissue and doing your strength training, you're re-educating the muscle to correct itself. So in theory, moving forward, you won't have to do so much. You just do it maybe as a maintenance thing. You may need to do it for a specific amount of time to get you to the point where you're feeling better, and you can go and off and do your strength, and then you can just use it as a bit of maintenance every now and then and dip into it, or if you start to feel a problem.
Exactly, because that's probably what we do, isn't it? So probably if I'm treating someone for chronic injury for the first time, you might treat them a few times in quick succession to change it, and they've got their exercises or whatever, and they're going back, and then you gradually take longer between the treatments, don't you, until they're feeling independent. And
that's also something people need to be aware of when you're having these kind of treatments, and particularly if you're being worked quite deeply on. You don't want to have too many too often. You got to leave a certain amount of time in between treatments. If you're having 2 or 3 of these treatments a week, you may end up a bit sore, may not be so good for you.
Such a thing as over treatment, isn't there? Unless you're doing sort of different things. Obviously depending what it is. What's going on.
So in terms of sort of conditions that people are going to be feeling at the moment, where maybe having some course of some soft tissue therapy, what kind of problems would this actually benefit from having some of this treatment? I mean, you touched on sort of impingement a little bit earlier. We know sort of a lot of lower back and chronic lower back pain can benefit from these sorts of things.
Yeah, I think most things can be benefited from soft tissue therapy, for sure. I mean, not acute, generally acute, you send off for medical assessment. So chartered physiotherapists and osteopaths and chiropractors, and get more of an acute assessment. But for all the chronic stuff, I can't think of anything where we wouldn't be useful. It's just some of those acute things. It's like some of the protective spasms and things, you don't want to necessarily release those, or you need, more inaccurate diagnosis. So we treat all the sort of plantar fascias, Achilles tendinopathy things, or this sort of recovery from strains and sprains, as shoulders, the tendinopathy type things. So tendons need the loading, but if you've got tennis elbow, golfer's elbow type stuff, you've got sort of often restrictions up the kinetic train, not only just the sort of forearm muscles, but sort of upper arm and neck and shoulders. So you're looking at mechanics of that. So then all those muscles are sort of released, primed for strengthening, to strengthen the tendon. So all the tendinopathies will benefit. Hamstring tendinopathy, all that hip stuff, all the piriformity, hamstring origin stuff, all good to sort of work all those tissues systematically. I think people sort of grinding away, don't you, on spiky balls in their glutes and stuff, but actually systematic treatment of the pelvic and hip muscles and lower back muscles will help all those very precise strengthening and rebalancing of all that area. All your mid-back stuff, rotation stuff, all that sort of breathing education stuff. Obviously all this sort of shallow breathing, you want to encourage all the breathing of the diaphragm, releasing all that, so deep breathing well. But it becomes a habit, doesn't it? Someone's tight here and they're using them all the time. It's hard to switch those off. You release those, switching off your accessory breathing muscles, engaging diaphragm.
And we know the breath is now becoming a big thing, becoming really important, even in sport now. Breath work and being able to breathe. As we say, we're a nation of is it heavy breathers or not heavy breathers? We breathe too much. We're breathing too quickly and too rapidly, and slowing that down as well, because that is going to affect how your muscles feel, all the tension and relaxation, and tapping into the parasympathetic.
So that's so other practitioners have done that, sort of treat someone, who you think, they've been. I sent someone to a physiotherapy friend of mine, and she. It was a sacroiliac lower back, and she was responding well. I sent her to my friend and said she just gave her some breathing. She said, I just gave her some breathing exercises. They're really subtle and weird. But then it was nice because I could work within her breathing exercises that she was given as the exercise from the you know, the accessory muscles that we use with breathing, or the scalenes and sternos and pec minors and things, and help her then do the breathing exercises she was given. So I've always liked those type of things when someone comes back to me with some very more unusual exercise that I don't always give out.
Yeah. I think what's good about what you do is it's a very much an integrative approach. You know, it's not just a one thing. No. You've got to look, like we were saying, you've got to look at so many different aspects, and bringing those all in as a more holistic and more rounded treatment, which I think is the key, really, as opposed to just coming and having a rub down with some nice oils. I'm not saying there's something wrong with that. You just want to relax, and that's good.
Say that there's something about full body massage, which is good, and obviously emotionally is relaxing. And as you know, when we're working at our events, you know, the intensity of competition, and sometimes, you know, you're wanting, we call it flushing massage, don't we? Or you're just thinking of just, you know, helping someone just recover emotionally, and then just lengthening the muscles and enhancing lymph and blood flow and recovery. So that's very valuable. And
I mean, that's actually something's just popped into my mind there. But if someone is playing, they may not be a professional athlete, but maybe, you know, I've had clients who are passionate about playing tennis or golf, and they go and take part in their own club competitions and things, and they're quite competitive. They train hard and stuff. I've had triathletes and everything, sort of, you know, midlifers and what have you, take it, and they take it seriously. So in terms of soft tissue therapy, when if you're coming off match and you're feeling very tight, very stiff, or you've had a bit of a long game for you, is that the right time for people to be having a deep treatment, or should it just be, you know, a flush? What is the research?
Great question, isn't it? And you know the answer as well as I do. But there's not really.
I've got to ask the question for the listeners.
It does depend on the person, doesn't it? I think on how intense it was and how intense the training was. And people have different ways they sort of wind down, but they're still learning. And I think it's practicing in training and competitions. But generally, I would say the science would be if you're sore, you're really sore, you're not going to be able, your tissues aren't going to be able to take a heavy treatment. But it is sort of going to be lighter, isn't it? So it depends sort of what you've done. But generally it would be lighter after intense exercise. But sometimes with the older athlete, and they've still got their granular tissue, and if you're used to treatment, you know what you want and you know how you're going to feel. And it's that's that communicative approach, isn't it, with the sort of therapist. So I think directly after, you don't need to go so deep either, because obviously the capillaries are open, muscles are there, and all sort of worked, aren't they, and semi-shortened. So,
but you know, I mean, we're talking a lot about athletes and everything, but it really is something that anyone could use in theory, just as part of, you know, the general health and well-being, even if you're not into your sport.
Yeah, because I think lifestyle often is contributes to, even at elite level, it's often lifestyle things, isn't it, that brings out injuries. Posture, sitting, traveling, standing. Because if you think about lifestyle generally at the moment, it's, I mean, I don't know, in some ways it's quite sedentary from, you know, your general day-to-day working environment. Unless you're somebody who does really into keeping fit and walking or going to the gym, playing sport, whatever it is, it can be quite sedentary. Yes. So sedentary is not great, but then moving probably too much isn't great either. So whatever that perfect way to be. Don't sit still, don't move either. So that perfect little balance of everything. Yes. You think of, that's why I think the phrase soft tissue therapy, and it's you've got massage, you've got sports massage, which people think of as heavy massage, or for sports people. And I think in the early days when I did call myself a sports massage therapist, I used to treat a lot of non-sports people, but I'd phone up and say, "Oh, I don't do any sports. Can I have a treatment though?" You know, you think, it's kind of a misleading title, isn't it? So it's not, and it's like, and some people do very physical jobs. They don't want to do sports. They don't want to go to the gym. If you do have a physical job, do you? You're tired. So it's like, so obviously it's very relevant. So soft tissue therapy is relevant for everybody, isn't it? So
Now you've also written a book, because your
Yeah.
soft tissue release book, and there are techniques. I mean, is that something that if somebody says, right, no, I just don't want to have to go to a therapist, is there something I can do to help myself? Is there little techniques that I can use myself? So like if my calves are a bit tight or my quads are a bit tight.
That I like doing workshops for groups of sports people, how to do self-treatments and things. And obviously there's lots of things people do, people know, and they've got their foam rollers and spiky balls, and sports people sort of, their massage guns, as we said earlier, that, there's lots you can do yourself. But the STR, I do like. I like to give that out to people, and some people love to. I like to say most people that come to me do quite like the treatment. They feel good from it and they like it. But some people do come and they don't like it. They still come because they feel better. And I say, well, you don't have to come. And I try and adapt to so you actually like it. But maybe you could find something else. But sometimes they just don't. Some people don't like massage or touch or whatever. They'd rather do something themselves.
I've had people who just don't want the massage. Maybe their partner, their husband, their wife has said, oh, you should have this, and they try it and they just don't like it. It's nothing personal.
So then there's a lot to like to, definitely. I think client empowerment, patient empowerment is just brilliant, and people do like it, and we're all like, I think, we like to be in control and be able to do something to help, and we all can be a little bit lazy and not say do our exercises, don't we? So I try and do less now. I used to give out too many things, so I try and do sort of less, a couple of little things, and I sort of call them, was it atomic habits, those type of little small things just to do at a certain time. You think, oh, this is the time you do it. It's like, oh, kitchen exercise or whatever, isn't it? You do an arabesque while the kettle's boiling or something. So I like to do little self-treatments after you've driven for a while or something, or after you've sat at the desk for a while. It's good, and STR is a very nice thing to be able to do that, and people do seem to like it. And sports people are useful because they do know their body. If they're putting their body on the line to compete, or you want to run fast, or hit a shuttlecock, or whatever you want to do, you want to do something with your body, where it's restricted, and a certain movement that it catches, so you will be happy to work within a certain movement to help free it. Some of that is a bit intuitive as well, isn't it? So with a bit of technical guidance and advice, you can make that a bit more effective, and people are happy to do it. And then some of those things, like plantar fasciitis, is a bit of a grotty one, isn't it, that can go on. But some of those, like self STR in the arch of the foot, you've got the ball for self massage, but actually getting your fingers in there and depending on,
and moving the toes, extending and flexing the toes while you're getting into there at the same time. But really, it's kind of like you're anchoring the muscle, you're holding the spot, and then you're just moving the joint to get a bit more range.
Yeah, but working up the chain, obviously, isn't it, and all the way to the mid back and the anterior, lower leg and things. Looking at the whole picture. But some of those, you can have quite very good results, can't you? And if someone's doing a little bit of homework in between, it does make it more effective, and then it makes it a little bit less uncomfortable as well.
So doing it yourself. So I mean, obviously, a lot of these people, we're here talking about anchoring the muscle and flex it. A lot of people aren't going to know how to do that.
No,
but they can get your book. Soft tissue. It's called Soft Tissue Release, isn't it? Mary Sanderson.
Or probably, I suppose, for the practitioner, but
there are some little techniques you can use if you want to figure out how to get tension, or approach someone like yourself and get in touch with you.
Most soft tissue therapists know how to do it, and then they'll show you a couple of things.
I mean, what sort of things? If someone's thinking, right, I want to find out more about the soft tissue, when they're going to speak to their therapist, what sort of questions should they be asking to find out if people can help them with these particular techniques?
Well, if they've gone to a soft tissue specialist, or if they've gone to...
if they're just out there exploring, trying to do it, find a soft tissue therapist, they might be coming up with sports massage, Swedish massage, all these different techniques. If they think, right, this person, I think, is a soft tissue therapist, what sort of questions?
Just look at their qualification, really. Ideally would be level 5, and check it's an accredited course of level 5, I would say. If you're looking for soft tissue therapy.
But also kind of ask them things like, do you do NMTs, neuromuscular therapy? Do you do myofascial release? Do you, assess? Do you assess my movement and all these kind of things?
Yes, or if they're in a practice with other practitioners, that's often good because you've got the inter-referral between the practice, haven't you? But I'd say soft tissue release, myofascial release, strain, counter strain, and neuromuscular therapy.
Yeah.
You do that,
And sort of be clear, and also when you go to your therapist, be very clear on what your problem is and what you need it to do. So don't be afraid to sort of tell them what you need, because that really helps them give the right treatment and like you've said, tailor it to what you want and how you like to feel during that treatment.
Would probably seek therapy because they're in pain of some variety, aren't they? So then they say, oh, obviously being completely truthful of where their pain is, then that's down to the therapist then to sort of help them unravel where it's coming from. Is it emotional tension, or is it lifestyle, is it your sport, or a combination of all of those? And unraveling all that through assessment, palpation assessment, and all the other ways, range of movements, and and function.
So, I mean, what would you say? So if people go down this route and they start thinking, right, I'm going to try some of this, if you would say to them briefly, what could they expect to feel? What's the sort of transformation and the benefits you feel from your experience and having worked with so many people, that the difference it's going to make to them?
Yeah, I think people are surprised. I mean, I think if you treat someone like I treat one of your clients, they wouldn't be surprised at what I'm doing. But if someone hasn't had soft tissue therapy, even if they'd had other therapy, they would be quite surprised. I think they'd be pleased. I think the feeling you're getting a treatment and being manhandled is quite a good experience. And even if you don't, because I must admit, when I was young, I didn't really like massage, actually, the oily massage.
No, I didn't.
Feeling juicy, and funnily enough, yes. But I remember my first experience with soft tissue release, where I think it was through clothes, a hamstring. It just felt positive. It felt dynamic, and it felt, oh gosh, this feels lively for my muscles. And I felt quite light on my feet, and I was jumping around afterwards. So I think someone would come in and feel good, and because sometimes now people feel stiff, especially older people, feeling you'd lost a bit of touch with your body and you're stiffening up, and actually having someone sort of touching you, especially trying to get it right the first time to help someone feel comfortable. And there's that whole thing, sometimes people don't necessarily want to take their clothes off or wear sports kit. Generally work through clothes with some of these techniques, or helping someone say, oh, did you know you can't turn so well to the left? And so someone was being touched and told a little bit some of their restrictions in quite a positive way. I think it's quite a positive experience, soft tissue therapy, isn't it? It's quite, so people say, you're a bit stiff, but I think we can improve that, or you can work on this in between, or, and let me know how you feel. It's very positive experience, and you usually send someone away with things they can do in between.
And that's a huge value, isn't it? Because then they're learning something as well, and they think, oh, I never knew that.
Yes.
Because no one's ever told them that before.
No, exactly. So I don't think it's surprising what people don't know, really, given they've been living in their body for so long. But we're all learning all the time, aren't we? And still picking up, from and we learn so much from our clients, don't we? Think of how someone's acquired certain restrictions. Because I do like treating people when they've had operations as well, and they've had enforced immobility. That's quite good too. So people are very grateful for that, aren't they? Getting their joints moving properly after they've been still for so long. Definitely work. Fascial tissues that have been immobilized. So did that answer your question?
It does, very well, thank you. Mary, we've kind of come to the end of our time, but now we know you've got a book, so I'm going to put the link to your book in the show notes. But if someone wanted to get in touch with you, whether they may not be in Hastings, but they could always ask you questions or email you or anything like that, is there somewhere that people can get in touch with you easily?
Yeah, so email's best. I think email me. Yeah.
Yep. And what's your email?
So it's Mary Sanderson at btinternet.com. And I'm happy.
Okay, I'll pop that link in there as well.
Not always efficient at responding, so apologies.
She will get to you eventually. Busy lady. Look, Mary, this has been really interesting and very insightful. People are going to learn a lot that they didn't know about their muscles and their soft tissue and their healing in their performance and how muscles respond as we age, and how important that this can be for them moving forward, and giving them that better feeling, better energy, better quality of life, which is what it's all about. So, Mary, I want to thank you for joining me today. Really, really do appreciate it. I'm very grateful for you taking the time to speak with me today.
Having me. Hope it was okay.
And thank you, everybody else. Like I say, subscribe to this channel, and put your comments in there as well. We'll see if we can answer some questions for you. But in the meantime, I want to thank everybody for listening, and I look forward to having you with us next time on Unleash Your Inner Athlete. Thank you. Goodbye. Thank you so much for joining us on this episode of Unleash Your Inner Athlete. You're clearly a very loyal listener and enjoying the content because you stayed all the way to the end, and that means so much to us here, as I love to see that you are enjoying the content we're bringing to you. And I want to be able to grow the channel more, bring you more fantastic guests, and give you more quality information that are going to help you maintain that quality of life you desire and keep you at peak performance. But in order to do that, I do need to ask one little favour, and that is, could you please subscribe to the channel and hit that notification bell? Because as the channel grows and we bring you more episodes, I want you to be the very first to get each episode and listen to that episode before anybody else can, as soon as it drops. So just do me that one favour, hit the notification bell, subscribe to the channel, and I look forward to seeing you next time here at Unleash Your Inner Athlete. Thank you so much for joining us.